Hello, YouTube family. Welcome back to the channel. I hope you're all doing well. Today, we're going to dive into the life and journey of one of Ethiopia's most influential and internationally recognized figures, Dr. Tedros Adhanom Ghebreyesus, the current Director General of the World Health Organization, WHO. This man's contributions to global health, politics, and his own country's development are truly remarkable. So, sit tight, and let's explore the extraordinary story of Dr. Tedros Adhanom. Tedros Adhanom Ghebreyesus was born on March 3, 1965, in Asmara, the capital of Eritrea, though he grew up in the Tigray region of Ethiopia. His upbringing in a rural environment with a deep connection to his roots shaped his understanding of the challenges faced by developing nations, especially in health. Growing up in Ethiopia during a time of civil unrest and poverty gave Tedros a first-hand look at the struggles of his people and deepened his resolve to bring change, not only to his country, but to the entire world. At the time of his birth, Eritrea was part of Ethiopia, before it became an independent nation in 1993. Tedros had a passion for public health from a young age. He earned his bachelor's degree in biology from the University of Asmara, followed by a master's in immunology of infectious diseases from the University of London. His commitment to tackling infectious diseases was further solidified during his academic journey. Later, he also completed his doctorate of philosophy, PhD, in community health from the University of Nottingham, setting a foundation for his groundbreaking work in global health. These academic achievements were pivotal in equipping him with the knowledge and tools necessary to fight against some of the world's most pressing health issues. Before taking on his role on the global stage, Tedros made significant strides in his home country. His career started in Ethiopia, where he held various crucial positions. His initial work focused on public health research and policy, where he collaborated with local and international organizations to tackle health crises. Tedros worked with the Ethiopian government on health-focused initiatives and played a key role in the national health policy reform process. His early work laid the foundation for his future success as a public health leader. In the late 1990s, Tedros began working with the World Health Organization and other global health organizations. His expertise in infectious diseases and his experience in Ethiopia's healthcare system made him an essential asset to international health efforts. His leadership in disease control and public health initiatives gained attention and respect from global health professionals. Tedros was involved in the country's efforts to combat HIV/AIDS, malaria, and tuberculosis, helping implement policies that would later become a model for other countries. Tedros's early efforts in public health were not confined to Ethiopia. His academic work and research on infectious diseases helped establish him as a rising figure in global health circles. His collaborations with international organizations and his dedication to improving healthcare systems in developing countries built his reputation as a committed advocate for global health equity. In 2005, Tedros was appointed as the Minister of Health of Ethiopia. Under his leadership, Ethiopia made monumental progress in healthcare, with significant reductions in child mortality and malaria rates, and a major expansion in access to essential medicines. Tedros's leadership was a catalyst for Ethiopia's health transformation, and his work was pivotal in bringing the country closer to achieving universal health coverage, which was a significant goal during his tenure. His efforts in healthcare also focused on improving maternal health, reducing the prevalence of diseases like HIV/AIDS and tuberculosis, and working on a better health infrastructure. As Minister of Health, Tedros implemented Ethiopia's Health Sector Development Program, which focused on expanding access to primary healthcare services. He helped to establish more than 15,000 health posts across the country, significantly improving access to healthcare in rural areas. His focus on community-based health initiatives was a cornerstone of his strategy, ensuring that healthcare services reached even the most remote parts of the country. Under Tedros's leadership, Ethiopia also made impressive strides in its fight against malaria, tuberculosis, and HIV/AIDS. Tedros helped lead the initiative to dramatically reduce malaria cases and deaths, with Ethiopia achieving the World Health Organization's goal of halting the transmission of malaria in several areas. The fight against tuberculosis also saw success, with a significant decline in the number of new cases. Tedros's achievements were recognized globally, and Ethiopia became a model for other developing countries in public health and disease management. Tedros's health-focused agenda extended beyond medical treatment. His government worked on building a sustainable and resilient health system, and the expansion of health education and infrastructure contributed significantly to Ethiopia's social and economic growth. He also worked to improve the quality of healthcare education in Ethiopia by establishing more medical schools, fostering homegrown talent, and reducing the reliance on foreign-trained medical professionals. In 2012, Tedros was appointed as Ethiopia's Minister of Foreign Affairs, where he played a pivotal role in representing his country on the global stage. His leadership earned him global recognition as an advocate for health diplomacy, particularly in addressing issues related to HIV/AIDS and malaria in Africa. Tedros became an important voice in international health discussions, especially regarding the fight against infectious diseases, and his diplomatic skills became critical in fostering international collaborations. Tedros worked tirelessly to strengthen Ethiopia's position within the African Union, the United Nations, and other international organizations. He advocated for stronger global health partnerships, particularly in Africa, where diseases like malaria and HIV/AIDS had devastating effects. His diplomatic success wasn't limited to health. Tedros also played a significant role in promoting Ethiopia's interests on the global political stage. During his tenure, he strengthened Ethiopia's ties with neighboring countries and worked to increase Ethiopia's role in regional and international peacekeeping efforts. Tedros's experience in foreign affairs was instrumental when he was later appointed as the Director General of the World Health Organization. Tedros's journey to the WHO began when he was named as Ethiopia's candidate for the WHO's top position. He was elected as the Director General of the World Health Organization in 2017, making history as the first African to hold this position. His tenure at the WHO has been defined by his leadership during several global health crises, particularly the COVID-19 pandemic, but it also built upon the foundation of work he had done throughout his career. Tedros is credited with transforming the WHO's approach to health by emphasizing universal health coverage, combating antimicrobial resistance, and advocating for the inclusion of mental health in global health discussions. His tenure has seen a focus on addressing the root causes of health inequities, especially in low and middle-income countries. Tedros's leadership has been a major force in the push for more inclusive, equitable, and accessible healthcare systems around the world. However, Tedros's career hasn't been without its challenges. One of the most significant controversies surrounding his leadership was his handling of the initial COVID-19 outbreak. Critics accused him of being slow to respond and of not taking stronger actions against China, where the virus originated. Yet Tedros has defended his decisions, maintaining that the WHO followed the best available scientific advice at the time. His efforts to support developing countries with medical supplies and public health guidance throughout the pandemic, however, showed his commitment to ensuring that vulnerable populations weren't left behind. Moreover, during the Tigray conflict, Tedros faced intense criticism from the Ethiopian government, especially as his role in global diplomacy grew. The Ethiopian government's opposition to his second-term candidacy for the WHO's top position was rooted in political tensions, as Tedros, hailing from the Tigray region, was seen by some as a symbol of the ethnic divide. His call for peace during the Tigray War, advocating for a ceasefire, and his comments on the humanitarian situation were seen as contentious by some, but earned him widespread praise internationally. His unwavering stance on calling for a ceasefire and a peaceful resolution, despite the political pressures he faced, showcased his commitment to human rights and his moral compass. Throughout his career, Tedros has consistently called for peace, especially in the context of conflicts in Ethiopia, Sudan, and the Middle East. During the Tigray War, Tedros spoke out, urging all sides to halt violence and prioritizing the well-being of civilians. His advocacy for peace is not limited to his homeland. He has been a vocal critic of violence in Gaza, Syria, and Sudan, calling for humanitarian aid and urging international collaboration to end suffering. His commitment to peace has not only been a central theme of his health work, but also of his broader diplomatic efforts in conflict zones across the world. His compassion for the victims of war and his call for global solidarity in times of crisis have positioned him as a leader not just in global health, but as a moral voice in international politics. This makes his leadership even more profound as he navigates the delicate balance between health, diplomacy, and political challenges. Tedros's belief in the power of collaboration and his ability to connect with world leaders and international organizations have allowed him to advocate for global solutions to health crises effectively. In December 2024, Tedros found himself in a dangerous situation while on an official visit to Yemen. He was preparing to board his flight at Sana'a International Airport when the airport was hit by an Israeli airstrike. Fortunately, Tedros was unharmed in the attack, which came during a time of heightened tensions in the region. This close call added yet another chapter to the high-stakes nature of his global work, where health and diplomacy intersect in often volatile environments. Despite the danger, Tedros remained focused on his mission of promoting peace and public health, demonstrating the unyielding dedication he has to his work. Looking ahead, Dr. Tedros's legacy is still unfolding. He has been a catalyst for change in the global health landscape, advocating for a more inclusive and equitable approach to health worldwide. His work continues to inspire young people, particularly from Africa, to pursue careers in public health and international diplomacy. His leadership has also been a testament to the resilience of the African continent and the potential of the Global South in shaping world affairs. As we look back on the life and achievements of Dr. Tedros Adhanom Ghebreyesus, we see a man who has dedicated his career to fighting for better health for all, a man who has faced immense challenges with grace, and a man who continues to shape the future of global health. His journey is not just one of personal achievement, but of service to humanity. Thank you for watching this video and for joining us as we explore the life of this remarkable Ethiopian legend. If you enjoyed the content, don't forget to like, share, and subscribe to the channel for more amazing stories about influential figures and global change makers. See you in the next video.